Welcome, team. This session on SCI Educational Series number 9 focuses on one of our most vital responsibilities, managing pain in SCI patients. Pain, especially neuropathic pain, is often chronic, debilitating, and difficult to control. It affects nearly every aspect of the patient's life, including sleep, mobility, mental health, and engagement in rehabilitation. When pain is not addressed promptly, it undermines recovery, delays functional improvement, and contributes to emotional distress and patient dissatisfaction. As SCI nurses, our ongoing observations, thorough assessments, and timely interventions are critical to improving outcomes. Uncontrolled pain can become a safety issue, leading to complications like depression, pressure injuries, or autonomic dysreflexia. By recognizing subtle signs and taking action early, we can help patients manage pain effectively, restore a sense of control, and ensure they feel heard and safe. My name is Michael J. Orellano, your SCI nurse educator. This presentation will walk us through the importance of pain management in SCI care, the best tools for assessment, prevention strategies, intervention techniques, and the signs that pain may signal a medical emergency. Let's reinforce our commitment to proactive, patient-centered pain care that prioritizes safety, dignity, and healing. Because safe care begins with early recognition and a responsive team. The purpose of today's session is to reinforce our knowledge and skill set in pain management with a special focus on safety for our spinal cord injury patients. First, we'll explore how unmanaged or underreported pain interferes with patient recovery, can lead to poor outcomes, and may compromise safety by increasing risks for depression, infection, or functional decline. Next, we'll examine tools that help us assess pain with more accuracy, including the numeric rating scale, behavioral cues, and specific SCI classifications. By understanding how to use these tools effectively, we can better distinguish different types of pain, such as nociceptive versus neuropathic, and respond with appropriate interventions. Finally, we'll highlight evidence-based prevention and treatment strategies, both pharmacological and non-pharmacological, that we can apply at the bedside. This includes repositioning, alignment, patient education, collaboration with interdisciplinary teams, and recognizing when pain signals an emergency such as autonomic dysreflexia. Through this session, the goal is to elevate our clinical practice by turning pain management into an integrated safety strategy, where every nurse plays a central role in improving quality of life and reducing harm. Let's aim for pain care that is proactive, responsive, and empowering for our patients and their families. Pain affects more than just comfort. It disrupts emotional health, engagement, and recovery. In SCI patients, chronic and neuropathic pain are common, often persistent, and difficult to treat. Studies show that up to 80% of patients with SCI experience neuropathic pain, and many describe it as one of the most challenging aspects of their injury. When pain is inadequately addressed, patients can develop depression, anxiety, and sleep disturbances. These issues then reduce their motivation to participate in therapy or follow care plans. They may begin to mistrust the healthcare team, feel unsafe in the hospital environment, or become non-compliant with medication or treatment. When we intervene early, pain becomes manageable rather than overwhelming. Trust is built when patients see that their pain concerns are taken seriously and addressed effectively. This leads to improved engagement, cooperation with the care plan, and faster functional gains. By consistently managing pain, we also prevent complications such as falls, pressure injuries, and autonomic dysreflexia. This slide reminds us that pain care isn't optional. It's a priority that builds credibility, safety, and recovery. SCI nurses are essential in this effort, leading with awareness, skill, and compassion. Pain assessment is the foundation of effective management. Without accurate assessment, treatment is often delayed or ineffective. For SCI patients who may have impaired sensation or communication barriers, this becomes even more crucial. We should routinely use structured tools such as the numeric rating scale NRS, observe behavioral cues like facial grimacing or resistance to care, and incorporate SCI-specific classification systems that categorize pain based on its origin. Understanding whether the pain is nociceptive, related to musculoskeletal issues, or neuropathic, stemming from nerve damage, is essential. Neuropathic pain often presents burning, tingling, or electric-like sensations, and responds differently to treatment than traditional pain. Proper classification guides medication choices and therapies. Equally important is timely documentation. Record pain scores on every shift, note responses to interventions, and include descriptive language that communicates patterns or changes. Documentation ensures that all team members stay informed and that appropriate adjustments can be made. Accurate, consistent assessments empower nurses to advocate for tailored treatment and timely interventions. When we document and communicate pain effectively, we improve safety, patient satisfaction, and interdisciplinary care outcomes. Prevention is one of the most powerful ways we can protect our patients from unnecessary suffering and complications. Our daily routine, repositioning every 2 hours, maintaining body alignment during transfers, and ensuring proper support during mobility, aren't just tasks, they're critical components of pain prevention. Incorrect body mechanics or neglecting repositioning schedules can cause joint strain, pressure injuries, and muscle spasms. By reinforcing adherence to these protocols, we reduce preventable pain episodes and improve comfort. Encouraging safe and regular mobility helps decrease muscle stiffness, supports circulation, and reduces the risk of spasticity and autonomic complications. Additionally, prevention includes patient education. Teach patients to report pain early, describe its quality, and identify any changes. Early reporting allows for timely adjustments in care before pain becomes severe or leads to emergencies. Prevention also reduces reliance on medication, minimizing side effects, and promoting functional independence. As SCI nurses, our role is not just to react but to anticipate. When we prioritize prevention strategies, we keep our patients ahead of pain and contribute directly to safer, more effective recovery trajectories. Effective pain management is holistic and patient-centered. A single solution does not fit all. Pharmacologic therapies, like gabapentin for neuropathic pain or baclofen for muscle spasms, are foundational but often insufficient on their own. Non-pharmacologic methods, such as battlefield acupuncture, guided relaxation, virtual walking therapy, and physical modalities like heat and massage, can provide added relief and improve outcomes. Studies support those combining interventions often lead to better pain control and higher patient satisfaction. Personalizing these plans is essential. Some patients respond well to touch and movement, others prefer quiet environments or distraction techniques. Understanding patient preferences and responses allows us to fine-tune interventions. Additionally, interdisciplinary collaboration is key. Working with the rehab team ensures consistent movement and stretching routines. Involving pharmacists helps optimize medication dosing. Behavioral health professionals can support emotional resilience and coping strategies. Our role is to coordinate these efforts and serve as the anchor for continuity of care. By combining interventions and leveraging interdisciplinary expertise, we ensure comprehensive, evidence-based, and patient-preferred pain relief. In SCI care, we must always consider the possibility that pain isn't just discomfort, it could be an emergency. Autonomic dysreflexia, or AD, is one of the most serious complications seen in patients with injuries at or above T6. It is triggered by noxious stimuli below the level of injury, such as a full bladder, impacted bowel, or skin irritation. Pain is often the first warning sign. Accompanying symptoms include a pounding headache, sudden rise in blood pressure, facial flushing, sweating, and bradycardia. If not addressed immediately, AD can escalate into seizures, stroke, or cardiac arrest. Nurses must act fast, elevate the head of the bed, remove tight clothing, and begin investigating and resolving the trigger. Check the patient's blood pressure immediately, and do not leave the patient unattended. If symptoms persist, notify the provider and administer prescribed antihypertensives. Document all actions taken and monitor vital signs closely. Recognizing AD as a pain-related emergency helps us save lives. This is not just clinical skill, it's vigilance. Our timely actions make the difference between escalation and resolution. Pain management thrives in a collaborative environment. As SCI nurses, we are the first to assess, intervene, and evaluate pain, but we must also communicate what we see. Regular updates to providers ensure that care plans remain effective and reflect the patient's changing condition. This communication is not just about relaying pain scores, it's about describing patterns, effectiveness of current interventions, and patient feedback. Collaboration is at the heart of successful pain care. Working closely with therapists helps align pain control with mobility goals. Pharmacists help optimize medication timing and dosing. Psychologists address the emotional toll of chronic pain, Sharing our successes and setbacks with each other promotes team learning. If one strategy helps a patient, it may help another. If something doesn't work, we can explore alternatives together. Open communication also builds trust within the team, encouraging a culture of support and mutual respect. When we coordinate efforts and share our observations, we improve care delivery and reinforce safety for every SCI patient on our unit. Educating patients and families transforms them into active participants in pain management. Many SCI patients do not initially recognize the difference between types of pain, muscle aches versus nerve-related burning sensations. Clarifying this distinction helps them report more accurately. Teaching patients how to describe intensity, triggers, and patterns empowers them to communicate more effectively with providers. Families are often the first to notice behavioral changes that indicate pain, especially in nonverbal or high-risk patients. Involving them in monitoring for signs like agitation, sweating, or sudden mood shifts can lead to earlier intervention. Discussing the long-term nature of SCI pain, the need for regular follow-up, and the range of available treatments helps set realistic expectations. When patients and families understand that pain is manageable but not always curable, they become more cooperative and engaged in care plans. Education also improves medication adherence and reduces anxiety. Ultimately, informed patients are safer patients. They know when to seek help, how to describe what they feel, and what to expect from the care team. As SCI nurses, we can make a lasting impact through every conversation, handout, and bedside teaching moment. In closing, pain management is more than symptom control. It is a critical element of patient safety and quality care in SC. Uncontrolled pain can spiral into complications that affect mobility, mood, participation in rehab, and even life-threatening emergencies like AD. Early identification is key, and that responsibility starts with us. We see the patients daily, we know their baselines, and we can detect when something is wrong. Our vigilance, communication, and documentation create a safety net that no one else can provide. By staying proactive, conducting frequent assessments, implementing preventive strategies, and initiating timely interventions, we not only reduce pain but also prevent pressure injuries, depression, and decline. Pain care builds patient trust and demonstrates the compassion that defines nursing. It reminds patients that their suffering matters and that they are not alone. When we say pain care is safety care, we affirm our commitment to excellence. Let's continue to lead with knowledge, skill, and heart as we make every effort to protect our veterans' dignity and well-being through smarter, safer, and more personalized pain management. These references are essential for providing a comprehensive, evidence-based overview of the management and treatment of pain in patients with spinal cord injuries, SCI. Spinal cord injuries can result in complex and chronic pain conditions, which significantly impact the quality of life and daily functioning of affected individuals. Each of these studies offers valuable insights into different aspects of pain management for SCI patients. Together, these references underscore the importance of multidisciplinary approaches and ongoing research to improve outcomes for SCI patients. Thank you for the time, energy, and commitment you bring to SCI nursing. Pain management is a complex but rewarding challenge, and your contributions make all the difference. Each of you plays an integral role in recognizing pain, advocating effective treatment, and collaborating to provide the best possible care. It's your attentiveness to small details, your willingness to listen, and your clinical judgment that help our veterans feel safe and supported. Moving forward, let's continue to apply what we've discussed today. Keep assessment tools within reach, reinforce prevention strategies, collaborate actively, and educate our patients and families. Let's also continue to share knowledge with each other, speak up when something isn't working, and celebrate each success story no matter how small. Through collective effort and continued growth, we can make pain care a cornerstone of safety in our SCI unit. Thank you again for everything you do and for showing up every day with the intention of doing what's best for those we serve. Again, thank you very much.